we talking about this coronavirus thing, and many don't think it can affect them. Initially there was this misconception that the coronavirus didn't really affect black people. They were like, "Oh, why come no black people were diagnosed?" And then Rudy Gobert came out, and that kind of debunked that myth. But that was kind of the. It's still. I mean, we talk about the block parties. That block party and over the Rhine.
Absolutely.
If you want to just talk a little bit about kind of your perspective, because I can go over some statistics on why this should not have been like surprising to people of color. I think
say that part again.
I think this should not have. I mean, the fact that they have released information saying that this virus affects African Americans more should not have been of a surprise, considering all of the many other things that affects us more. When you talk about
For sure.
health and economics, employment, any of those different things. So
they say when what is it when America catches the cold, Black America catches the flu? Is that what they say?
That's exactly what
For
they
sure.
say. That's exactly what they say.
Not to mention, I think I was looking into something, and I see that we as African Americans have the highest mortality rates, right?
Exactly.
Diabetes, heart diseases, and things of that nature. Even AIDS to some degree.
Exactly.
Which makes us more susceptible, more high risk with catching that. So I don't think that we should be surprised that Black people are catching it at a higher rate. Going back to your point earlier about how it was the myth that Black people couldn't catch it. I think it was just late. It caught on late because it was wealthy white Americans who was traveling from overseas and things of that nature. And not even just wealthy white Americans, but wealthier people coming from China in different spaces.
Right.
So then once it starts to spread, one of my biggest things is how the essential workers, the frontline workers, are right there to catch it. So anyone who's wealthy, you have to go to Kroger's typically.
Right.
You have to pump gas typically, right? So anyone who is wealthy is going to interact at some point, or anyone who has it is going to interact at some point with just your everyday person. And I think once one Black person catches it, since we live in such close proximity, it leads to another one, and then it just multiplies for sure.
Gotcha. No, I agree with that, man. And just in case there's some people who, I mean, I'm hoping that everyone's informed now, but just in case there's some people who are not as informed, according to the World Health Organization, the coronavirus disease is an infectious disease caused by a newly discovered coronavirus. So there's always been, coronavirus strains, but this new one is what we're dealing with now, the novel coronavirus, right? So most people infected with coronavirus will experience mild to moderate respiratory illness and recover without requiring any special treatment. Older people, right? It's the older people that we worry about. Typically young people, typically people who don't have any underlying issues, they'll be able to recover from it. But it's our grandparents, it's our older uncles, our older aunts, our parents. Those are the people that this can affect. Particularly if they have underlying symptoms, right? Because it attacks your respiratory system, your lungs, all that good stuff, right? Underlying medical conditions such as you mentioned diabetes, any cardiovascular disease, diabetes, chronic respiratory disease, and cancers. People that got those kind of things are more likely to develop a serious illness. So, with that being said, I mean, as I spoke about earlier, it shouldn't be a surprise. I mean, really, and I mean, I might be more privy to know because I work for a health foundation. I'm a little more aware for those things, and I know other people, like yourself, you've done a research to understand exactly why this is the case, right? But I want to talk a little bit about in Over the Rhine. Remember in Over the Rhine last Saturday, right?
For sure.
The people, African Americans. It's like a block party. It's probably about 100 people outside. They're on top of cars. They're all close to each other, and there was one guy on camera saying, fuck the coronavirus. I don't believe the coronavirus. Excuse my French, but so one might be easily dismissed. Oh, they're just stupid, right? But really, my question is why did he do that? And again, it was more than just him outside. It was a bunch of people outside.
Did you see the more recent one?
No,
So,
I
and there
didn't.
was another one as well. There was a block party, I believe, in Millville recently.
Okay, yeah, I did see that video. Yes, sir. Yes, sir. Yes, sir.
Yeah,
Yes,
for
sir.
sure.
Yes, sir.
I think it was in Millville, so don't misquote me. I know it was recently a block party.
Okay.
And so your question is why, right?
Yeah. Like, you know, why is it that why are we saying that? Like, is there something deeper there, right? And I'm gonna get into what I think it is, but
yeah,
no, I just want to. I'm sure you're gonna hit it right on the nail, but if you could talk a little bit about that, man.
To me. So what
Okay.
I had to do is I had to reach out to somebody who I know is outside and be outside, right? Who's in the streets and just lives a life where it's a reckless life, so to speak, right? So whenever it's something going on in the streets that I don't understand, or that I can't relate to anymore, that I'll reach out to him and we was just talking and he put it to me in these terms. Whereas every day there are people who are got their lives on the line. They getting shot at. They're shooting at people. They might be getting robbed, or they're getting robbed. Every day they taking heightened risk, right? So it's like, fuck it, I could die any day anyway. So I'm not about to sit down in the house and just twiddle my thumbs. I might have to go outside to get money. I might have to go outside to do this. So just because this is here doesn't make me want, or just because the coronavirus is here and they might not even be hearing about all the statistics that you and I are hearing about. Right? I think that's one thing.
Yep.
And also, they don't see the deaths. You know what I'm saying? So in Cincinnati, I think Melba Morse reported that there are only 134 confirmed cases within Hamilton County. Right. And I think only as of recently, there's only been 3 deaths from the coronavirus. So as you mentioned as well, it's not a lot of young people getting infected. That's one. And I don't even want to say it's not a lot of young people getting infected. It's not a lot of young people seeing the symptoms. Right. So I think with that being said, out of sight, out of mind, man, and it's funny because I was talking to a friend and we talk about that YOLO life, right?
Yes.
And that's one of the things that comes into play, right? So I think to sum it all up, it's, man, every day our life is at risk, right? Every day there could be something that endangers us. So fuck it, I'm going to go outside. I'm going to live my life the way I'm going to live my life. And it's a defiance against the law as well, right? The final point that I'll make to that is, if it's been a system that we feel like has never cared for us, right? Whether it be the justice system or whoever, right? Why would we listen to them all of a sudden and stay in the house just because they told us to stay in the house? Right. So.
No, and I completely agree with you. I've kind of had the same thing you said. I kind of had to reach out because I didn't understand it. I'm like, hey, they're telling us to stay in the house. Why aren't you staying in the house, right? I'm not a person that lives in the streets. I'm familiar, and I know a lot of people do. So I reached out just like you did, and kind of get understanding like why. And some people just simply don't believe it, man. They don't believe it to be any real issue. They don't believe it to that it can really affect them, and they're just not buying it, And when we come from a society that doesn't value people that look like us, like they should, you're gonna have that disbelief. You're gonna have that mistrust. You know what I mean? This thing has came on kind of quick, man. They kind of downplayed it when it was over in China. Then when it came here, the cases started building. Really just keep building and building and building. And one of the biggest challenges is this testing, right? We don't have the widespread testing. Initially, you had a lot of people, initially, oh, it's just a flu, right? It's not that serious. It's just a bad flu. And they were putting up statistics about, oh, this many people die from the flu. This only many people die from the coronavirus, which was very misleading, and I'll explain why. It's very misleading because you're comparing something that has widespread testing, something that has a vaccine, right? You're comparing that to something that's new that we don't know anything about yet. It's very new, and so when people were sharing those statistics, it's like, okay, this many people die from the flu, this many people die from the coronavirus. Of course, it's going to be skewed toward the flu, right? And we have a vaccine for the flu. So what happened, now you have over that, I don't know how many people are dying a day in the United States.
Yeah.
But in the worst year for the flu, I think it was 2017, 2018, in the past decade, you had over 500 people dying a day from the flu. Now you got it's over 1,000 people dying a day from the coronavirus. So
At least I think it's in the several thousands.
Yes, it may be at this point. And so what's happened is we're now at a place where, whoa, this is serious. I know some of my Facebook friends, man, they were just, oh, don't believe this, screw this. They were out, and I mean that's why they had to crack down. That's why Governor DeWine and many of the other governors had to crack down and say, all right, we're closing everything. I seen it coming, like this is gonna really hurt the African American community.
So really I think one thing I want to acknowledge is that I think people also think those numbers are inflated, right? I think people are saying that there are deaths, that people are just government officials, health officials are just piling deaths up under the moniker of the coronavirus or COVID-19, right? Mm-hmm, so I do want to point that out, that's one thing that people are saying. Yeah. Whether that's right or wrong, there's widespread death going on, right? Exactly. And I think a lot of it does have to do with the coronavirus.
Yes. Yes.
But I can't get behind or wrap my mind behind people saying, don't believe this or this isn't. This is my biggest thing. The NBA shut down.
Yes.
Major League Baseball shut down.
Yes.
I work for a Citigroup, right?
Yes.
A financial institution.
Yes.
Fortune 50 company, right? Yes. Sending people home, costing millions, paying people to work from home, right?
Yeah.
People are not losing. These corporations aren't losing billions of dollars, billions, right? Hundreds of millions of dollars off of something that they haven't had their own medical teams research, right? This is official. This is a thing, man.
Yeah,
so when I hear people say, it's a facade, right? It's a hoax or whatever, I can't get behind that. I can't even entertain that, Mo.
It's very difficult. It's very, very, very
Let
difficult.
me ask you something.
Yes, sir.
My man Jonte asked us to address the 5G conspiracy. And what I've heard or read about the 5G conspiracy is that having 5G can suppress your immune system, which makes you more susceptible to the coronavirus. What do you say to the 5G conspiracy theorist?
I don't buy it. I hate to just be as frank with that. When this first was discovered in China, I don't know if they have 5G in China. And honestly, I just when people started talking about that, I really didn't even read into it that much. I think there are more valid things that are more explained by science that can determine why people are dying from this. And I want to address something you said earlier. You said something about how people are putting these deaths under the moniker of coronavirus. Oftentimes when people are dying, is what it is they contract this disease, right? And then what happens is they develop pneumonia or some other kind of, and that is what's killing them. But they put it under the coronavirus because the coronavirus indeed weakens their immune system.
That's a good point.
So, which is why they're saying this many people die from coronavirus. And what happens is they're getting fevers, they're not able to shake their cough. And mind you still got the flu going on, you still got colds, you still got all these other things going on. So just because somebody coughing or somebody got a headache or whatever doesn't mean they got the coronavirus, right? Well, initially, 6 months ago, you would have thought you just had the common cold, right?
Mm-hmm.
I've also heard people suggest, like, hey, you know what? I think this has been here. What do you think?
Say that again?
I think this has been here. I think this virus has been here. So, I recall, man, I was in December, man, first week in December. Now, that's kind of early because they hadn't even discovered it in China until that time. But, I recall being, now I'm not a person that necessarily gets sick a lot, right? I recall, man, I couldn't shake this cough, man. I had a headache. I didn't know what it was. It wasn't, and then for about a week, man, and eventually it cleared up. But I just couldn't understand it. And then there's other people saying, I remember other people, January, February, they're like,
my sister, February. My sister was all of the symptoms in February. Sick, throat hurting, diarrhea, all of that, right? So, but the funny thing about that is we were around her and nobody got infected, right? Nobody got infected as well, that we're aware of. So I do think that's interesting, but carry on.
Yeah. So the whole 5G thing, man, I'm not buying that, you know. And oftentimes people want to do conspiracy. Even they think it's a conspiracy theory that they're trying to somehow say that it's more affecting African Americans. They don't. And when you know, if you're public health, if you work in public health or anything like that, you know these things. You know that, you know, as we talked about before, we have a higher rates of COPD. Well, let me rephrase that. So I got some statistics here. You know, background rates of chronic diseases like diabetes, heart disease, and high blood pressure in Black people contribute to higher COVID-19 death rates, right? But aside from that, other contributors include inequities in testing access. That's one of the things. That's one of the things to mention as well. Like, we're not getting tested. You know anybody that's been tested?
I don't.
I mean, I know a couple people, but they were older and they had these symptoms and they were older, so they've been tested. So the question is, if I'm young and I want to go in and get a test, are they going to test me?
So again, bro, I think I'm taking on the responsibility of right now to speak for people who don't have access to medical insurance, right? Who can't afford to take off of work to go get tested, right? And then also when we look at the testing statistics, we have to dig a little bit deeper, because one, when all of this started hitting the fan, they didn't have a lot of testing kits. We were behind the curve as far as the testing kits are concerned. But also we have to look at the statistic of, are we being tested? Like you said, right? So when we do start talking about the people who are being tested, what percentage of African Americans are being tested in comparison to the percentage of the Asian community, the Hispanic community, the white community? And the thing that, to me, a big point about the coronavirus, which I find so interesting, is we have to look at the health disparity, bro. It affects everyone. If you go into Kroger's, right? Kroger, because everyone typically has to go into Kroger. You have to get your groceries, right? Your Targets, you're going to see an African-American employee, right? And you can be infected just by whatever your employee is. You're going to see a frontline worker, and you can be infected by these frontline workers. So we should be concerned for the frontline workers. We are not, how can I put this? We are not to the point where we're immune. There we go. We are not immune to getting this virus. So I just think, man, when you look at the health disparities, I think the wealth disparities as well, man. I think that's why, on the grand scheme of things, once we come out of this, right, which I truly believe we will, once we come out of this, we have to revisit the healthcare discussions and things of that nature, because if one person can get sick or something like this that's airborne, then we have to start worrying about everybody being sick, and how do we find vaccines to help these people?
Exactly. And I want to bring up a quote, kind of something you touched on. Dr. Patrice Harris, she's the president of the American Medical Association. She said, quote, "Many workers on the front lines working in transportation, food, delivery service may not have privilege of working from home." So, you know, there was this thing where everybody's working from home. Well, you know, I work at Kroger's, you know, I work at Target, like you mentioned, you know, many of these things. I go into Kroger's over in Norwood. I go into Kroger's over here. Majority of the service workers are African Americans. So yes, there's an overrepresentation in those types of jobs. As a result, we are more exposed to it because more people are coming around to the store. So
for sure,
you know, I think something they were saying, we're about I think 30% of the cases in Ohio are African American. We only make up what, 13, 14% of the
13%
of the state of Ohio. So that right there tells you, like, it's because, and you look at I think anytime, and the Dr. Fauci, you know, he brought this up. You know, he said at Tuesday's White House coronavirus press briefing, he said, and the reason I want to bring this up, because I couldn't help sitting there reflecting on how sometimes when you're in the middle of a crisis, like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. That's what he said, right? And you know, a lot of people gave him like hurrah for that, like wow, because you know, oftentimes what happens is, you know, people that don't look like us don't have as much concern about issues that affect us. They don't, you know.
I'm gonna talk to this too. So
Yeah.
I think that's interesting, right?
Yeah.
And I think that's natural, right? I think that's natural. I think it's natural to be more concerned about people who look like you because you can relate to it more, right?
Okay. Yeah.
So,
Agreed.
I just want to say, in agreement with you, I give kudos to him, to someone who can step outside themselves, right, and look at the world as a whole, right, and then look at people who don't look like them and say, hey, these people are being affected as well. So that's good for him, man. That's dope. Yeah. But then I think he can't. It's to a point where he can't ignore it either, right? He can't ignore it either.
Right. No, I agree with that. And so you know, we talk about Hurricane Katrina, right? You remember when all that happened? I mean, you know, as the dust started settling, you start to see, oh, who are the people that really got affected by this? But over proportionally, it was the Black and brown people, African American people who don't have as much resources and things like that. So you know, we and I'm not one that wants to sit there and you know, talk about race and beat it with a stick or whatnot. But you know, a person's life chances is best. The thing that predicts most than anything else, a person's life chances is their race. It's the race. One's race determines, you know, more than anything, not determines, it can predict where a person's going to live, their education attainment level, their health level, employment, all of those different.
So let me ask you that. So you're saying that one's race, even more so than their income level, will determine their life chances?
Exactly. Well, yes, the statistics.
We're going to have to look into that because I'm interested in that.
Yeah. So there was this racial equity workshop put on by Greater Cincinnati Foundation.
Okay.
And the first course was called Groundwater. And it stated that. So I went into it, looked into it, but yes, like, and it really shocked me. It said, yeah. But if a person's born and you wanted to predict how they're gonna be, what their life chances are, you first, the best predictor of a person born is their race. Because of structural racism. And Rod, structural racism. What is it? What is it? What is structural racism? Because some people, you know, they throw that term around a lot, but I got a definition here. So if you want me to read that, I can do that.
You can, but I'm going to, without knowing the definition.
You know the definition. You know the definition. You know the definition.
I don't know it, but you'll give it to me. When I first hear that, immediately I think of something along the lines of systematic racism, where there's already barriers in place that prevents one from, that has the ceiling and the floor levels for that person. But what is it?
That's exactly what it is, you know. And here's a definition from the Aspen Institute Roundtable on Community Change. It's a group doing work to help others understand structural racism. The term structural racism refers to a system in which public policies, institutional practices, cultural representations, and other norms work in various, often reinforcing ways to perpetuate race group inequity. The structural racism lens allows us to see that as a society, we more or less take for granted a context of white leadership, dominance, and privilege. This dominant consensus on race is the frame that shapes our attitudes and judgments about social issues. It has come about as a result of the way that historically accumulated white privilege, national values, and contemporary culture have interacted so as to preserve the gaps between white Americans and Americans of color.
But just like you know what, Mo? So when I hear that, I agree with it, right? But this is my thing, man. And this is where I hope that we begin to transition as Black people to understand these things aren't new to us. You know what I'm saying? No. I grew up, my mother used to say, and I didn't understand at the time how impactful this was. She was like, you was born with 2 strikes against you. Yeah. Right? Yeah. And she was like, you're Black and you're a male. Right? Like, that's some fucked up shit. Now that you think about it, though, like, you already thinking you're behind the 8 ball. And my mother, like, lived in fear for my life. But these things aren't new to us. So it's like, when we start talking about racism, when we start talking about systematic injustice, right? I think we do need people to fight against those systems, but I also know that we need to put ourselves in the best places to succeed. Our margin for error is so thin, right? Our margin for error is so thin. Like with the coronavirus, we're on the front lines. Like with someone getting pulled over or, you know, mistakenly reaching for something, whatever the case may be, our margin for error is so thin. I'm not justifying it. By no means am I justifying it. I want to be very clear about that. But I just know that we have to put ourselves in positions to be better. So when we talk about going back to the what's the church, Mo?
Solid Rock.
Solid Rock.
Yep, Solid Rock
Congregations
Church.
of 100 people. Even more so, today or yesterday, I think there was a protest at the state capitol outside of DeWine's. Over 100 people protested what's going on. I didn't hear about not one arrest from that. I didn't hear about one arrest from the protest. You hear me? So, and I seen the pictures. There was no social distancing. There was no social distancing.
At all.
None. So, so what I'm saying, I say that to the point now, people will argue, well, they didn't arrest anyone at Solid Rock that I'm aware of. They didn't arrest anyone at these protests that I'm aware of. But they arrest the young guy who is saying, fuck the corona. And it's because you out there blatantly saying, fuck the corona. Not excusing it, not justifying it. Everybody should be held to the same standards. But they want to make an example out of someone. And who better than a black male with tattoos on his face to make an example of? So if you all want to have block parties, right? If you all want to go out here, understand that you run the risk of being held in captivity on trumped up charges, right? Not fair, but we can't make those type of mistakes.
We cannot, man. You know, you got to work, as we always say, we got to work twice as hard to get half the recognition, man. You got to, man. You know,
for sure.
And I often, you know, I often have to reflect sometimes, man, because, you know, being an African American male, right, especially being a bigger one, right, I have to be careful, man, and how I talk to people, how I look at people, how I approach people, all of those different things, man. And even so, you still face those things. Is where, you know, I had a particular instance where I was helping a client with something, and she, you know, helped her, you know, great, you know, Caucasian lady, everything went great, right? But then she tells a person, another person that we know, you know, and this is in a joking manner. She tells the person, she says, wow, Maurice is nice, right? Cool. I work hard to be nice, you know. But he has a very booming voice. It's kind of scary. That's what she said. It's kind of scary. He has a booming voice, and it's kind of scary. And so the lady told me that, which another white lady told me that, and I'm kind of looking at her like, really? Like, you don't tell a black man that he's scary. You don't tell him that, because that's a stereotype we battling against every day. Right.
Do you feel like if it would have been a black person who said you got a booming voice and it's kind of scary, if you would have took the same offense to it?
I maybe not to that same degree, but I think I would have. I think my mind would have said, I still would have came to a point like we need to fight. When I'm trying to fight against these like stereotypes, you know, and I mean, you know, God made me to have a deep voice, you know,
for sure,
made me as big as I am or whatever.
I didn't notice.
Like, right. But you know, that's the challenge, you know, and how while this is whoa, I don't know what that was. That's the challenge, man, and you know, living in a society like this, man, you know, there's people who, you know, are people who have this ever-present anger, man, this ever-present anger. They just really like angry all the time, you know, and that goes back to, you know, talking about adverse childhood experiences, many of these other different things. But this ever-present anger, man, due to the structures that we have in place that really try to keep us down, man, it's really real. And unfortunately, man, you know, again, there's gonna be some people who listen. I think most people listen to this are gonna love it, but there's gonna be some people say, "Oh, here they go talking about race. Here they go, yeah, right." But those are the same people who do absolutely nothing. You know, they don't
say that again. Those are the same people who what?
Who do absolutely nothing to you know, aside from maybe working with them. You know, you look at their friends. They don't have many white friends. They don't have many. You know, I mean, they don't have many black friends. They don't really do. And I'm not saying it's their duty to do so, but there's a reason why we talk about these things. And I think it's important to acknowledge, like, hey, you know, there's a problem here What little thing can I do? You know.
But see, and I think for me, Mo, I think that's where I'm like, I don't even try, right, to reach across the aisle and convince anyone of any other race to say, hey, acknowledge this problem or assist with this problem, because I don't expect that, right? I just don't expect it. It's like,
right.
Excuse me. It's like people are looking out for themselves. Now, if someone does it willingly, right? If they do it willingly, I'm all for it. But I think it takes too much energy to try to convince someone of your own struggles. And I think after so long and after reading and seeing so many conversations of people saying how long slavery was and how long this was and how you can pull yourself up by your bootstraps and things of that nature without actually having to go through those things, I've realized that people are set in their ways, right? Yeah. And I know it'll be very difficult for someone to change my mind. So now what I try to do is the people who are within my 1, 2, 3, 4 degrees of separation, those are the people who I try to influence to some degree, and not even influence, but educate. Right, I think that's the biggest thing, and I think that's what we are beginning to do here, Maurice and JeRod, is bring education to the forefront of our community. I think that's super important, man. Super important. There was one more thing I wanted to speak with COVID. Of course. There's one more thing that I wanted to speak with it.
Okay, appreciate that.
No, for sure. 47% of blacks in Hamilton County, right, are in poverty. So that's 47%. Nearly half of the community is in poverty. Social distancing isn't really possible, right? We living in dense areas. What if you could say anything, right? I got 5 minutes before I got to jet. If you could say anything to a person who, this is the profile. I'm gonna give you a profile.
Okay, yeah.
Felon. This is a felon. They're in the streets, right? They don't trust the system, right? I don't even like being inside. I haven't been inside my whole life. I've been from house to house. I've always been outside. How can you convince them to stay inside and take precautionary measures for COVID?
Well, you know that's the challenge, man. And I would the way that I think you can convince someone like that is to to kind of detail what could happen if they continue to move around. They go over their mother's house. Their mother's 60-something. She has an underlying condition, and she gets sick. And come to find out, you're the person who's asymptomatic. You're going to her house, visiting her, all in her face and things or whatever that may be. You've essentially, passed on the coronavirus to her, and then she gets really sick and she passes away. That could possibly happen. In fact, I bet that has happened. So I would just I would just show a person the real dangers. Here are the dangers of moving around like that. You don't want to believe it or whatnot, but look, it's happening, and it can happen to you. Because oftentimes when people, until something happens to them, they don't take it that serious, right? You talk about seatbelts, right? I mean, you talk about some of this stuff. Some people still don't wear seatbelts, right? Until someone close to them, whoa, they went through the window, they died. Had they had a seatbelt on, they would have survived. That's just a simple example. But with this coronavirus stuff, it's very serious because the data is there. We have higher rates of many of these different ailments that can make us really sick from the coronavirus, particularly our older African Americans. So that's what I would tell a person like that to think about. Hey,
I think that's fair.
You can move around. If you need to do what you do, okay, that's fine. But just practice that social distance, 6 feet. Wear the mask. For me, I'm gonna talk about the mask really thing. I know you said you got a couple minutes. The mask situation. The mask situation. I didn't buy that they were saying, masks don't work. I think what they were trying to do was and again, somebody classify this as a conspiracy theory, but I didn't buy. I think, why not cover something on your face? That way nothing gets in. If you're sick, you're not getting nothing out. Now they change their mind and say, now we think you should all wear masks, and they don't have to.
It's funny you said that, because I was buying the masks don't work, but I didn't give it a second thought, and that goes to critical thinking. Yep. I appreciate you being a critical thinker, because these credible sources said masks don't work, so I wasn't really looking at it like that. So I appreciate you being a critical thinker.
Yeah. So now everybody, and see now people, if you know how to cut masks, you embroider or something, I got a little Cincinnati Reds one. I almost want to go get it, but it's another room. I don't want to get up. But I didn't buy that. So I think, to your point, back to your story though, wear a mask, wear personal protective equipment, wear those things. Practice social distancing. They're telling us, they're educated. They say, hey, do these things, we can flatten the curve. You flatten the curve. I mean, it's gonna go on a little longer, but look, we don't want our people dying. And our people are more susceptible to it. That's what it comes down to. American lives. Our families' lives. That's really what this comes down to. And we have to do whatever we can to protect our lives. Because when you ain't alive, this money don't mean nothing.
That's a very, very valid
Any of
point.
these different things don't mean anything. But that's any last points? I see you got something.
Yeah. We might have to follow up. We'll definitely have to do this again soon.
We will. And we'll do it.
I think
with Zoom as well, and we'll share the Zoom link out. People could
the mental effect, right? The mental lasting effect afterwards. So, for instance, as you said, my brother actually lost his mom within this. Yeah, my brother in Lexington, right? My stepbrother, he actually lost his mom. So, condolences to him for sure. Condolences to him and my sister. And my sister.
Yeah.
So I know it's real, right?
Yeah.
But what I will also say is people may have children, right? PTSD. Like, we don't think about the kids are living through this where we have to train them to stay away. They can't go outside and play. And not to say many of them were anyway.
Right.
But to say, you can't do this. You can't touch this person. You can't interact, right? We're training people with sending people to work from home. We are essentially training an entirely different workforce. We're forcing people to learn how to work from home. Now it's a digital thing. And I wonder what the lasting effects of this will be. Will people not go back to brick and mortars? Like banking, right? A lot of banking we do digitally now. So I'm interested in the lasting effects aside from health, right? On the economy and things of that nature. I'm definitely interested in how that affects.
Yeah. And we're going to see it. And maybe we'll say that for the next video. Maybe we need to do this again next week or something. More structured. Because I thought the Facebook Live would work where I could have that live. But with the Zoom, we can get everybody. Here's the link. You get yours and get on Zoom. And then if we want to even bring somebody in and talk about whatever it may be, we can do that. So,
I think that'd be a great idea.
Yes, sir. So, hey, man, thank you, man. Because I seen your post, man, and I'm like, man, we got to talk, man. Because we always, every time we hook up, man, every time we have a really deep and thoughtful discussion, man. I don't get to have those, all the time, right? Only, and with you, man, I was like, man, I got to talk to my boy Rod, man, because you always have a very wholesome perspective, man, and it's greatly appreciated, man.
Hey, much love. Let's contact each other soon. Let's figure out how we can make this a more consistent thing, man.
Yes, sir, man.
All right, I'll talk to you soon, man.
Much love. Yes, sir.